we're going to see the target BP, and this is in the hypertensive patients, and we are strictly going to look at the European Society. We are looking at the European Society of Cardiology. This will be the guidelines, and this is nothing but of 2018. So let's get started. So firstly, we'll be looking at the age group of 18 to 65 years. So under the age group of 18 to 65 years, here there is a target systolic range. So this is a target systolic range if tolerated. So here, when we look at the hypertension, it refers to 120 to 130. This is 120 to 130 mmHg. And when you look at the coexisting diabetes, so under coexisting diabetes, it is about 120 to 130 mmHg. Next, we look at the coexisting chronic kidney disease. So coexisting chronic kidney disease, and here it is about 130 to 140 mmHg. And next, in cases of the coexisting coronary artery disease, so we look at the coexisting coronary artery disease. So here it is about 120 to 130 mmHg. Then we look at the coexisting stroke or the TIA, transient ischemic attack. So here it will be around 120 to 130 mmHg. Next, we will look at the 65 to 79 years. So we look at the 65 to 79 years. Here the target systolic range if tolerated. Here again the target systolic range if tolerated. So here the hypertension is from there is 130 to 139 mmHg. This is in case of the hypertension. And next, in case of the coexisting diabetes, so coexisting diabetes, so in this case it is about 130 to 139 mmHg. And next, in case of the coexisting chronic kidney disease, that is in case of the CKD, it is about 132, same as 139. So what we are saying here is in hypertension, coexisting diabetes, and in the coexisting chronic kidney disease, all it is 130 to 139 mmHg. And next, when we look at the coexisting coronary artery disease, here also it's 130 to 139. And lastly, when we look at the coexisting stroke or the ITA, here also it is nothing but 130 to 139 mmHg. So next we'll be looking at another category, that is the office diastolic measurement. The diastolic measurement. So here there is a reading of 170 to 79 mmHg. This is in case of the hypertension. And coexisting diabetes, here also it is about 70 to 79 mmHg. Then in case of the coexisting CKD, that is a chronic kidney disease, here also it is about 70 to 79 mmHg. And later, when we move on to the coexisting coronary artery disease, CAD, here it is again 70 to 79 mmHg. And lastly, when we look at the coexisting stroke or TIA, so in case of the coexisting stroke, so we look at stroke or the TIA. Here also, if you see, it is again 70 to 79. So this was the video on the target BP, and we saw the in case of hypertensive patients, and this was strictly according to the European Society of the Cardiological Guidelines, and this was of 2018. So to learn and grow daily like this, please do subscribe.